Right. Welcome, guys. I'm Malcolm Valdez. I'm a registered psychiatric nurse. I'm working at Royal Melbourne Hospital, Northwestern Mental Health. So I just finished my work as well. So good morning, good afternoon, and good evening to all of you guys. As a start, I'm just going to do an acknowledgement of the country. In the spirit of reconciliation, I acknowledge the traditional custodian of the country throughout Australia and their connection to land, sea, and community. I pay my respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander people today. So I'm just going to go for a quick overview of what is eating disorder and who is actually affected by it. So the number of people with eating disorder in Australia is estimated to be around 1 million, or approximately 40% of the population. To further break it down, there's 47% have binge eating disorder, or we call them BED. 12% have Bulimia Nervosa, and 3% have Anorexia Nervosa, and 30% have other eating disorders. A recent review found that worldwide lifetime prevalence of eating disorder was 8.4 for females and 2.2 for males. It has shown that the prevalence has been increasing over time as well. Moreover, eating disorders along with substance use disorders have the highest mortality rate of all psychiatric disorders, and cardiovascular complication is the leading cause of death among people with anorexia nervosa, followed by suicide. I just want to discuss as well the types of eating disorder. So we have, again, binge eating disorder, we call them BED. During the binge eating episodes, a person may not be hungry, but may continue to eat past the point of feeling comfortably full. It is common for people to binge eat alone or in secrets and experience intense feeling of guilt, shame, disgust, followed by a low mood after a binge. And then we have anorexia nervosa, which has a two subtype, which is restrictive subtype and binge eating or purge subtype. So restrictive subtype, this is the most commonly known type of anorexia nervosa, whereby a person severely restricts their food intake. Restriction may take many forms, like maintaining very low caloric intake, restricting types of food, and eating only one meal at a time. It may also follow with obsessive and rigid rules, like only eating food of one color. I remember I have had like patients before who only eat white food. So they only eat milk, or they only eat white bread, nothing else. And then we have binge eating disorders. It's a form when a person restricts their intake, but also has a regular engaged in binge eating or purging behavior, like self-induced vomiting, over-exercising, misuse of laxative, diuretics, or enemas. And then we have bulimia nervosa. Bulimia nervosa differs from binge eating disorder, as the binge episodes are associated with a sense of lost control, and immediately followed by a feeling of guilt and shame, which then leads the person to have to do compensatory behaviors, like immediately purging themselves of the foods they just ate. A person with bulimia nervosa usually maintains an average weight, or maybe slightly above or below the average weight for their height, which often it's less recognizable than a serious case of anorexia nervosa. I just want to say as well that, you know, the term eating disorder, binge eating disorder, and anorexia nervosa, it is used to describe as a human experience and expression of suffering. It is a real experience. I mean, we all experience suffering and distress at some point, and some of us use alcohol to manage that suffering. Some of us use dieting to feel better about ourselves and gain a sense of control or feeling of normalcy. And some of us soothe ourselves with food or relationship. This is not far from other experiences that we all share. It is just that these clients become so familiar with the habits so that they have this condition. Who can be affected by eating disorder? Again, it's everybody. It doesn't matter the age, the gender, or the gender identity of the person, their race, ethnicity, relationship status, geographic area. Anyone can have it, even educational attainment or income level. There is a stigma that if you have an eating disorder, you should be a young female with an affluent background. And it only shows that eating disorder affects everybody. Who's at risk? Normally, young girls are more likely to be, the captive of the eating disorder than male counterparts. And binge eating disorder, it is almost equal prevalence, really. And then we have the LGBTQI community. It's just because in LGBT, there's always, you have to look like this, and, peer pressure and the influence of the media. And particularly the transgender community is at most risk of this because they're not really honed to their body and they feel like, they're in a cage. And that becomes, the cause of it. And then you have indigenous population. Disordered eating can occur with athletes as well, in any sport, any time, crossing boundaries of gender, age, body size, culture, socioeconomic background, athletic caliber or ability. Just a quick note, these are the famous people who have eating disorder. So we have Nancy Kerrigan. She's a darling of during the 90s. She's a figure skater. She gained the title of United States champion and numerous Olympic medals. And then we have Kathy Johnson. She's a gymnast who developed anorexia nervosa after a harsh criticism about her weight from her coach. And then we have Nigel Owens. He's a Welsh guy, union referee, and they all have these eating disorders, and it only shows that everybody can be affected by eating disorder. So what is the cause? Actually, there's none. There's no single cause of eating disorder has been identified, and eating disorders develop from a complex interaction of psychological risk factors. It could be social cultural influences and also biological and genetic predispositions. Eating disorders are frequently associated with psychological and physical disorders such as depression, anxiety disorders, substance abuse, and personality disorders. Recent research, including twin studies, genome studies, and familial aggregation of eating disorders, indicates genetics play a substantial role in etiology of eating disorders. So what's the complication? As you have known, there's a lot of cardiovascular problem with this population. So they've been starving for like years and years and years. And as we know, if the body cannot cope with it, it will eat up the muscles. And we all know that heart is a big portion of muscles. And it's fascinating phenomenon that the body just eat up portions of the brain, and hence they have this cardiac atrophy. Secondly, these clients they restrict everything, including with water. So they have this big electrolyte imbalance. And most of the time, when we work in monitoring clinic, and they know that they're being monitored by their weight, they just drink loads and loads of water. And that's really dangerous for them, because their electrolytes were just going to go through the roof, or it's just going to be depleted. And bradycardia is also one of the problems, and loss of autonomic control. So you have fainting spells or lightheadedness, and most of the time they just like fall on as soon as they stand. Just a warning, like these conditions are made worse by vigorous activity and dehydration. So what is art therapy? It is the expression or application of human creative skill and imagination, typically in a visual form, such as painting or sculpting, producing works to be appreciated primarily for their beauty or narratives. It can also be in a form of drawing, writing, dance, music, and drama. And because of this, art therapy provides a unique adjunct approach for managing patients with eating disorders. Across literature, art therapy is used in managing symptoms of eating disorders, such as body dysmorphia, and it involves music therapy, dance, or we call them movement therapy, and creative art therapy. Through art-based therapies, our clients who suffers from eating disorders evokes emotional response and bypass intellectualization, thus allowing these patients to express what's happening in their body in a less analytical manner. Art therapies provide feelings of safety and comfort, which facilitates self-expression and insight building. So why study the effects of art therapy to body dysmorphia and eating disorder? Well, despite the range of treatment modalities such as interpersonal, cognitive behavioral, family system, and pharmacotherapeutic therapies to manage body dysmorphia and eating disorder, there is a paucity of studies substantiating the hypothesis that these therapies are effective. So I've done this research, hoping to bring us together, make basically, the topic that I'm hoping to bring together is what is the role of art therapy in recovery, in the treatment of eating disorder, but also preventing the symptoms of eating disorders such as body dysmorphia. So today I'll present the 6 literature that was reviewed and included in the study. I don't want to bore you with how I do my research and studies and all that, but I've done the search strategies. As you can see, I've done databases, I've used mesh terminologies and subheadings and Boolean logic. And here's what I found. There was 57 articles, and I removed 8 because of the duplication of it. Abstracts and title of the remaining 49 articles were initially reviewed, but then I removed 43 of them for the following reasons. Some of them are conference abstracts, some of them doesn't have any art therapy, some of them have different intervention, some of them just discuss the pathology of eating disorder, some of them are qualitative study, and one is a pediatric population. Again, my study is about eating disorder in adults. And so I conclude that I have 6 articles were reviewed and included in my study. And the key highlights, I'll start with Thaler and his friends in 2017. It is a cohort without control group, and it is an evidence level 3. And it shows that after the museum-based art therapy, majority of the domains of bipolar profile of mood states was significantly lower, except for elated depression, confident is unsure, and it is unclear-headed and confused, I mentioned. What it means is that after the museum-based therapy, there was a decrease in all eating, preoccupation, and urge domains. However, only the eating a snack dimension was significantly lower. So to give you a little bit of context, once our client goes to our inpatient unit, they normally eat 6 meals a day. So that includes the main meal, breakfast, lunch, and dinner, and they have morning tea, afternoon tea, and supper. So again, the research suggests that, you know, the only snack they mentioned was significantly lower to that. And then let's move to Savitaki. So Savitaki, it is a level 2 evidence and a quasi-experimental prospectively controlled study. And it shows that participants who received dance movement therapy had a better score in body area satisfaction and appearance evaluation score with a value of 0.95 and 1.1 respectively, and a significantly lower appearance orientation score with an effect size of 1.3. Although there was a decrease in overweight preoccupation post-dance movement therapy, the change was not statistically significant. Where does dance therapy come from? It is from performing arts. So the sense of performing as a dancer or seeing an aesthetic experience in dance is what dance therapy is based on. Seeing the body experience change is very, you know, moving for these clients. I mean, think about when you dance. What do you normally do? You smile, you become silly, you dance, you touch people. But we also experience increased heart rate, increased respiratory rate, and those things are really effective for these clients because they, you know, this movement therapy becomes their creative space, and it becomes a foster the therapeutic relationship between people. It makes connection in the physical level. And why do we need creativity? It is to help us transcend the traditional, the normal mundane event in our life. It helps us make change in our life and adopt a change. I mean, when I work with my clients, I always make something from nothing. Think about the idea of gesture, an image as like a moment to focus on that. If you transform them, they can give you more information about the world. For instance, if you open your hand, it's an open hand gesture. What does it mean? And I've done this with my client, and they said to allow, to release, to give, to attach. And I asked, what if you close them? And they said to hold, closed, to protect, to guard. It is a very simple exercise, but it gives so much meaning. It gives them a chance to see their illness and health in a different way. It is a chance for them to let go of the illness so they could present themselves as healthy, moving human beings that has a chance in a dance session to be healthy, to be looked at, to be validated, to be seen as healthy people, as movers, as dancers. With dance therapy, there is a sense of community as well. There was a give and take phenomena, and they could learn to delay self-gratification or accommodate others and be mindful of their surroundings, focusing in here and now rather than ruminating about how they look or what people say to them is really important for these clients. And this dance therapy really helps them. And then we have Provost in 1999. It is a level 3 cohort with control group study revealed that those who receive art therapy had significantly lower body attitude and eating disorder scores after second and third time frame compared to baseline mean scores. Body attitude examine the body experience in the outcome categories. 11% has changed and worsened, and 50% of the clients consider themselves is basically improved. And then I have Frisch in 2006. It is a level 4 cross-sectional design study, and it shows that art therapy can be generally categorized into 3 subtypes: music therapy, dance or movement therapy, and creative art therapy. Clients' participation rate with art-related therapy range from 90.55% to 99.38%. And among the different types of art therapy, 4.5 hours was average time per week were allotted for art therapy, while dance and music therapies had 25 minutes and 32 minutes respectively. The program offered a wide variety of reasons for incorporating art-based therapies, including self-discovery, self-exploration, and self-expression. Others reported that art-based therapies allowed clients to face challenging issues such as self-esteem, body image, depression, and a tendency to isolate by providing an alternative, healthy outlet of expression of emotion and development of positive coping skills. And let's discuss music therapy. Music therapy is primarily utilized music as a therapy tool. Music is used most often in the treatment of eating disorder as a tool for self-discovery or as a method of relaxation. Some examples including background music to facilitate breathing, positive imagery, and meditation. And then there's a dance therapy. It is often misunderstood because of its name. This specialization or specialized form of treatment is not simply limited to be a dance and movement. The majority of dance movement therapy based their therapeutic art on the idea that the body and mind are unconsciously connected and strive to impact the mind through some type of direct work with the body. In other words, positive effects on the body may often result in positive change within the mind. And then there is creative art-based therapy, or we call them CAT, primarily focused and utilized drama, role-playing, drawing, painting, and sculpting as a therapeutic tool, and arguably the most widely employed of the 3 forms of art-based therapies. Each author stressed the importance of the creative arts as an alternative means of expression and exploration of feelings. And then we have Extricate. It is a 2009 level 3 cohort without control group revealed that after the therapy, there were a large improvement in eating disorder pathology. there was a large improvement in overall psychological functioning, except for anorexia nervosa restrictive subtype. And anorexia nervosa purging had a better total body attitude. And the bulimia nervosa have a similar result with that. The reason being is because anorexia nervosa restrictive domain or subtype, they're very consistent with the rules. They follow the rules. And, you know, when you do art-based therapy, it's free flowing. It's, there's no rules. Everything can be art, you know, and they find it difficult to manage that. And then lastly, and one of my favorites, Carrie in 2009, it is a level 1 and a randomized control clinical trial design, shows that individualized yoga treatment reduced food preoccupation immediately after yoga sessions. The eating disorder examination, the score was decreased over time until 12 weeks of the intervention. But what is yoga therapy? In a broad sense, yoga is helpful for clients with eating disorder because it helps foster positive embodiment. That means feeling at home in your own body or feeling at home in your own skin. This is something that, as you might imagine, is often lacking in people with eating disorder. It gives them a sense of agency, which would give them a feeling of, you know, being in the driver's seat of their own life. And this yoga therapy is like a fostering agency for people in their own body, so that they start feeling like this is their body, it is their home, but this is the space that they need to have refuge and their vessel for moving through the world. But what now? Well, the finding of the study have two important clinical applications in the field of mental health nursing. First, art therapy, such as individualized yoga, can be implemented as an adjunct non-pharmacological management of body dysmorphia among adults with eating disorders. And second, nurses can explore the effectiveness of other art-based therapies in the management of body dysmorphia among adults with eating disorder and determine the potential benefits of using such treatment modality to this subgroup of adult population. And for that, I'll give you my references. And thank you for listening. And remember, let's connect, eat, and thrive.